This is Rhea, and this is Just the Who of Us, where we talk about a range of topics, including life events, current events, spirituality, entertainment, family relationships, as well as answering listener questions and more.
That's the only difference between a murder board and an ADHD conversation. It never narrows down.
Right.
It's just
You never get to the solution.
usually an ADHD person has to talk to a non-ADHD person to get to a solution. Which is
Yeah,
ironic because my therapist has ADHD.
really?
Yeah, she technically diagnosed me before my psychiatrist did.
Hmm.
Well, it was because I was diagnosed when I was like 6, 7. At
Yeah,
least what my parents told me. And they just believed that I was a child who got out of the orphanage in a bad situation. I was just an excited child.
right.
Well, usually ADHD stems from trauma. It doesn't just appear out of nowhere. I mean, I guess in some cases it can. You know what I mean, though.
Yeah.
It's a neural pathways of your mind that was created over time.
Most neurological, no, let me not neurological. Most psychological diagnoses stem from trauma.
Yeah. I mean, if you take out trauma out of the DSM-5, it'd be like 1 inch thick. It
Right.
it would not have, and honestly, I think a lot of disorders are just different symptoms mixed in different orders to create
Yeah.
basically a new, and there's only like one or two things that are actually different from the other ones. You know what I mean? Where it's
Yeah.
just, I believe, like, don't get me wrong, they're still different. But they only have like one or two symptoms that are the difference that
Right.
gives you
Yeah.
that
Minor
diagnosis.
differences.
Exactly. I mean, I think I was talking to somebody on a Facebook group in the agoraphobia group, and
Probably.
this person was saying that anxiety is not a mental disorder, and that, it's just like pathways, it's what he say? He says something along the lines of like, it's just pattern. It's just pattern. You learn the pattern. But I was like, neural pathways are the reasons for those patterns. Like, I mean, neural pathways are formed and
Yeah.
it creates a system. What makes it a mental health issue, uh, a mental disorder, is the fact that it's basically doing what you're not designed to do. It's overdoing its job.
Yeah.
Like
I
it's
think,
too much of anything, it's terrible. Like I mean,
yeah.
like the reason why I'm agoraphobic is because the anxiety is taking over.
Right.
And that is created through trauma, through neural pathways that have been built over and over and over again. So yes, it's pattern, but not saying it's mental disorder. I'm just
I,
like, everything's a mental disorder. If you think about it, we need the brain to fucking do shit. I mean, what makes it a disorder is that it
it's
doesn't
abnormal.
accumulate positive things. You don't produce positive things. You don't, or your actions and your way of thinking, it's not that of a neurotypical person.
Right. I think people tend to forget or just aren't educated
Mhm.
properly that these things are a result of a chemical imbalance.
Hmm.
I've dealt with ADHD my whole life. I have kids who have ADHD, and I've been so anti-medication for a long time. And
Hmm.
one of the things, and I knew this, I learned about it, I know it from life experience. But one of the things that my cousin pointed out to me was like, medication with certain things, and ADHD being one of those, there's a chemical component missing in our brain, and that medication helps to replace it. And I
Right.
was like, damn, like that
Mhm.
makes sense. Like I'm looking at medication from a point of addiction and things
Right.
like that. I'm not looking at it from a point from a medical standpoint. But when she
Right.
put it that way, I was like, damn, like
I mean, you can avoid, in my opinion, 9 out of 10 times you can avoid addiction, in my opinion. Because the reason why I say that is because I have a very addictive personality. I'm aware of this. And I have two controlled substance in my possession, and I have not abused it once because I take it as prescribed. I take it as, you know. And I'm not saying that as prescribed won't eventually can turn into something,
Right.
because there are uneducated doctors and psychiatrists out there. But my psychiatrist is probably one of the most educated ones out there, in my opinion, because she is the best one I've had so far.
Hmm.
And she listens to me. She knows I have this fear. And she also knows that I have gained trust with her. She's like, I know you're not actually gonna abuse this drug, like you've
Right.
created this trust, you create all this. And also one thing, like I'm on clonazepam, one of the most addictive substances out there. It's just, especially for a person who has anxiety or whatever, it can become very addictive pretty quickly.
Yeah.
And one thing that she told me, because there was this one time I asked her, "Hey, can I go on this daily because it does help me with anxiety, but if I can build it into my system and maybe it could knock out the anxiety for the most part." She was
Hmm.
like, and I was like, okay, like, may I ask why? Just out of curiosity, why? And she
Yeah.
was like, first of all, a lot of psychiatrists are trying to get rid of benzos. They're trying to get rid of it. So if I retire or if I move or whatever, or I go to a different place and you can't come with me or something,
Yeah.
most likely you're going to have a very hard time finding someone who can prescribe you that. And then another reason she says, because it's not daily medication. It's not meant to be used daily. It's supposed to be used as needed. If you need a daily anxiety medication, we could keep this medication and give you a different medication because
Yeah.
this is only used for as needed. And it's been proven over time daily. I mean, it's not every person, but it's been proven that being on that type of medication on a daily basis for years on end is terrible for your physical health overall. So.
Yeah. Yeah.
It's like when I hear people in my agoraphobia group or whatever saying that they're on clonazepam on a daily basis or whatever, I'm like, you need
Wow.
to be careful with that shit because
Yeah.
like that's insane to me. Like it's I'm like this is not meant to be a daily thing. It's not because like I said, a lot of psychiatrists are trying to get benzos out of uh try to stop prescribing it and stuff, which I don't exactly know the science behind that. Maybe it's because too many people are getting addicted or whatever.
Yeah.
Honestly, I think Xanax is the one that gave it a bad rap, basically, you know what I mean? That's the most well-known one, I think it is.
Yeah.
Xanax. But clonazepam and what my psychiatrist said, if I remember correctly, was like clonazepam was actually more addictive than Xanax just because I don't know, she said just makes you calm. Whatever, you know what I mean? Like I don't
Yeah.
know. I don't know what behind it is because I think what clonazepam does for me is I don't get any side effects from it. It just calms my body down, doesn't make me tired mentally, doesn't make me
Really?
it doesn't like drowse me out. It just calms my body, but doesn't like make me feel sleepy or tired. I've taken it when I'm in full-blown panic attack, about 5, 10, maybe 15 tops, it's gone. Like it's still there. Like I can still feel the energy of it, like the anxiety, but it's not like overpower. It's not like taking me over.
It's not like incapacitating.
Exactly, because there was one time I was in a dentist chair. This was like one of the first times I've ever taken it. And I always get scared taking a new medication. And so
Right.
I was in a dentist chair and I just start crying, shaking. The anxiety was just debilitating. And my dad's like, okay, you need to take this. Like this, you brought this for a reason. You need to take it now. And I was like, okay, because I'm like, at this point, what's the worst it's gonna do? I'm gonna panic either way, like. And so, like, I'm gonna panic with the medication helping me with it, or I'm gonna panic without the medication. So at this point,
Yeah.
what was the difference at this
Like
point?
I'm gonna feel something either way. So
Exactly. And this time I'm more panicking about something else than the medication at that point. It was like two lessers of the evil at that point. So
right.
I take the medication, and then maybe about 5, 10 minutes later, they could notice I was calm, chill, just I wasn't tired. I wasn't anything. My body was just like, okay, cool. Like what's up, bro? You know what I mean? Like, and
Right.
they were able to get it done, whatever, you know. And then now when I go to the dentist, I always just take the medication before I go in. Because first of all, I know next time I go, I know I'm gonna have cavities. I know I have not been treating my teeth right, but also my acid reflux has been really messing up. And you know how acid really messes with your teeth?
Yeah.
Like I think it's more of the acid more than anything. You know what I mean?
Yeah.
But like I'm afraid to go because I'm like I know I have shit going on in here
Yeah.
and I don't want those pointy things in my damn teeth, like like it's not even the anxiety of going there, it's the anxiety of I know they're gonna have to poke and see where it hurts and all this type of stuff. And my teeth hurting just thinking about it. Like, like well my teeth not actually hurting, but you know what I mean, just
Yeah. Yeah.
psychosomatic, but
Yeah.
I it's just like I'm scared of that, you know what I mean? And so but I take a medication before I go in and it's like, oh, you look a lot calmer today. And I'm like, well, yeah, I took medication before I came in, like,
Yeah.
and it's kicking in before we start the process and stuff. So
I used to have a different perspective on anxiety and panic attacks.
hmm
Honestly, until I started experiencing it myself,
hmm
I used to kind of be, I guess, a little judgy about it. Like,
Most people are. If they don't experience it, they are. My parents are.
right,
I'm not gonna
right.
lie. Like they are very invalidating when it comes to these anxiety attacks. They're like everything's all right. And I'm like, that doesn't help me because I don't think a lot
Yeah,
of people
like it's
realize
a physical feeling in your
right,
body. It's not like you're looking around trying to find something wrong.
right. And also, I don't think
Yeah,
people understand you can't logical your way out of an anxiety attack.
yeah,
You just
yeah,
can't.
yeah. It's a
It's just
chemical reaction in your
right.
body. That's one thing that I didn't understand about it until
hmm
I started. Like, I was having panic attacks. Actually was getting tested for seizures because that's what we thought they were. Like, I would all but
hmm
pass out.
hmm
Um, and just so randomly, I'm a people person. I like being around people. Places with a lot of people don't bother me, never have. And then all of a sudden, I just started like when I go into a public place, I just started getting like really lightheaded. Like I was like,
Yep, that's what I go through now.
yeah, and I'm like, what is happening? Like, am I having seizures? Like it was bad because
Yeah,
like
no.
kids would be with me and I would like fall to the floor and they'd have to like help me.
hmm
But it was crazy because like I was like, I don't like I'm not worried about anything. Like I'm not scared of being here.
Right.
And it wasn't even a mental thing. It was a purely physical thing. And then that's when
Right.
I really started understanding anxiety
hmm
and panic attacks. Like I'm
They're
not even I'm not intentionally stressing out about anything
hmm
about this what's happening.
right. hmm
Um, but yeah, I think it's like it's just like ADHD. People either there's a large amount of miseducation and a lack of education.
And I
And
think there's also a lot of misuse of it.
yes,
A
yes,
misuse of diagnosis when people are like,
right,
that's such a I'm so ADHD and I'm
right,
like
right.
no, you're not. You just are either impulsive, you're just, or
Yeah,
or when people use OCD wrong. And I'm like, no, you're not OCD. You're just finding a neurotypical way of trying to be special. Like not trying to be
yeah,
special, but you know what I mean? Like, I mean, because I'm like, oh, so you had thoughts that someone was gonna die if you didn't do this. That's what's
right,
going on. They'll be like, what? No. And I'm like, you don't have OCD then.
right.
No,
Yeah,
because OCD behaviors are backed by thoughts and compulsions of like, if I don't do this, this is what's going to happen. It gives you
yeah,
some form of control when you don't feel like you have control of other things around you. So it
yeah,
gives you a false sense of control. That's what OCD is. But then you have different types of OCD. You have harm OCD, you have sexual OCD, you have all these different types. I personally have the
sexual.
overall,
Yeah,
kind of, no, not really, actually, but I know a person who does, but I have harm OCD and I have also kind of the umbrella OCD, which
mhm,
is because I also have other OCD habits that I do that's not based on harm OCD. So, like, I'll give you an example. Like, when I go out, I need to bring my medication, my ice, my drink. If I don't, I feel like it's going to be the worst experience of my life. It gives me also that is preparedness, yes.
Yeah,
And I will physically stress the fuck out if I don't have those shit with me because I think I'm going to die without it.
yeah.
It goes with that feeling of control. It comes with that feeling of like I need to make feel like I have some form of control over everything around me that I don't really have control over, but I need to do this to feel like I do. So it's a false
Yeah.
sense of control, and I'm aware of that. And
Well, but and again, like we said, typically it goes back to some form of trauma.
right,
Um, I've heard over the years many people, as with any new thing that comes out, oh, I must be blah blah blah.
yeah,
And I've heard, oh, I'm so OCD, I'm so OCD. No, you don't have to like touch something three
right,
times specifically. You don't have to turn this knob so many times. You don't
mhm,
my oh, I'm so OCD because I like things clean and in place. No,
right.
you just
No,
clean it in place. Like
right. I
let's
mean,
not minimize the actuality of
exactly, because
emotion.
I mean, to be fair, there's that one scene in The Big Bang Theory that comes to mind when Penny was doing it just to annoy Sheldon. She was going,
Yeah.
Sheldon,
Oh
Sheldon,
yeah.
Sheldon, and he was like, at first it started off as a joke, but after you got to like this third one, it actually felt pretty good, didn't it? She's like, yeah, I'm not gonna lie, I kind of want to do it again because the thing about it is our brain craves pattern. Now, it doesn't. We're all I feel like there's OCD in a sense, but not really. Because, like I said, OCD comes with more than just this, but our
Right.
brain loves pattern.
Yeah.
It loves the, like, you know what I mean?
We like repetition.
It loves that repetition. It likes to have no, it also does kind of give a feeling of structure, you know? So I think
Right.
people confuse structure and wanting to get a quick boost of dopamine or
Yeah.
serotonin, whatever the one it is, or both, whatever. I honestly I always get confused with those two because they people use them together so much that they use them so much together. But I think dopamine is like a happy chemical, whereas serotonin is no, it's a happy chemical too. I don't know the difference between serotonin and dopamine.
Okay. So
You looking it up?
yeah, because I want to make sure that I'm like precise in how I explain it.
Hmm. But like I'll say, but with like my point, it's just I think a quick shot of something that makes your brain go yay for a second is completely different than what OCD is. You know what I mean?
Right.
Like being in a clean area would make someone feel good, would make someone feel nice. You know what I mean? But that's
Yeah.
not OCD behavior behind it. It's just because you just like a clean area. I mean, I would think a lot of people will like clean areas, you know what I mean?
Right.
And the same goes with you know what's kind of a way to explain it I just thought of? It's perfect because I feel like a lot of people have this experience, even people who don't have OCD. And it's that feeling, you ever turn off the lights and you run to your bed because you feel like someone's chasing you?
No, but sure, yes.
Wait, what? You never do that? Like you never turn off the lights and be like, oh shit, I must get to the bed and you run? No?
Oh,
It must be
oh.
my generation thing. Anyhow, uh,
I mean, I don't know. Maybe when I was a kid, like dark places and small places don't bother me.
even as a kid, I mean, that's what I'm talking about. As a kid, what we all used to do is we turn
You
off the
know, you
lights.
meant today, last night.
Huh? Huh?
You know, you meant last night.
No, actually, but but that's a way to perfectly explain sort of what OCD is. There's a illogical thought behind something, and now you must do an action to avoid that ending.
Yeah, yeah, yeah,
It
yeah,
gives you that short
yeah.
bit of anxiety. Now, did every I know a lot of kids used to do it because I've seen TikToks and everybody's like, we all have the same experience, you know? But
Yeah,
not, I'm guessing not all of them have OCD. Just because you've done that doesn't mean you have OCD, but that's a way to perfectly explain it. It's you get his thought. You must do this action now to avoid that happening. Even though you logically know it's not true, you
yeah,
still get that wave of anxiety, that wave of panic, and you get back to your bed as soon as possible, you know, because
yeah,
it's like you're afraid that the monster's going to get you or whatever. Even though you logically know it's not there,
yeah,
you feel that anxiety, and now you do an action to get rid of that anxiety.
yeah.
So
Um,
I feel like that's the perfect way to explain to a neurotypical more of like how
yes,
OCD can, like
yeah,
with me. Sometimes I would hear somebody go on an elevator and I would get scared. I'm like, I have to get into my apartment before they come out and I see them. And that brings me so much anxiety. I don't know why. And that's what I used to do growing up. Like if I was in a bathroom and I would go outside of the bathroom and there's someone else in the other stall and I'm washing my hands, I hear the flush. I don't even dry my hands, I run.
I
Because it's
do
like I
that.
got it in, it's like I got into my mind that now I gotta get out before this person comes out.
No, I do that now, but not like I
I
don't
do
know
that
what
now
it is.
too, but
I don't
yeah.
know what it is. Yeah, like I need to be out of here before you're out of the stall, and
Hey,
for absolutely no reason because they're not
exactly. It's like
gonna
we
do
don't
anything
think that
to
they're
me.
actually a threat or anything. It's just
Right. Like we can't see each other for whatever reasons. Although we just did the same thing. I don't know. Like
right. It has nothing to do with what you're doing or where you are. It's just that's how it is. I'm like that's how it was me. I'm like, oh shit, now I have a spike of anxiety and fear right now. I must get out, you know?
yeah.
I'm still wash my hands, you know, I'm not gonna be gross about it. I'll still wash my hands. And sometimes they'll come out before I finish washing my hands. I'm like, damn it, but it's like I get, and when they see me, they see a startled face on my look, and like, "Are you okay?" And I'm like, "Yeah, just some
Simply first.
exactly like I was avoid seeing your existence, and you fucked it all up now." Like, I mean, but like I just like it's something that's I don't, there's all these things I used to do as a kid that I'm just like, how did nobody see the fucking signs of shit? You know what I mean? Like
Yeah.
I'm like I did all these things that is ADHD. I did all these things that led up to OCD. I've done all these things that showed I have BPD. Like I mean, like that's
Yeah, but it's also difficult in kids too because sometimes certain things can be a factor. The environment can be a factor. When my oldest son is very ADHD too, but
oh,
when
really? Couldn't tell.
right, right. When he was little,
Hmm.
um, we we had a short stay at behavioral health,
Hmm.
and
Oh,
because
love that place. I've
right,
been
and
there 3 times.
because he was very aggressive,
Hmm.
just very like it was concerning for him, you know, for his safety and everything. I mean, there was one time he was in the classroom and he's like throwing chairs across the room. Now, he never hurt anyone. He never put his hands on anyone,
Hmm.
but situations were very dangerous. And so, you know, we had him evaluated for certain things. Now, during all of that, me and my ex-husband, the house was very tense. We
Hmm.
were not on, you know, we were going through a very rough time. The house was tense and his environment was very just tense, you
Hmm.
know, and there was a lot going on in his world.
Hmm.
Now, had all of that been different, has had his home been more safe, more calm, more peaceful, things might not have been extreme on his end.
Hmm.
So, you know, I think sometimes when you couple the environment with the diagnosis, it intensifies things. And
Hmm.
so it's difficult sometimes to tell and to diagnose.
I and that's something. I can completely understand because that's what my parents were saying when I was first diagnosed with ADHD. They're like, she's a kid who just got out of the orphanage. She couldn't leave. Like, like all she knows is this building and right outside of it. This is
Right.
all she knows. And so therefore, of course, a child's going to be running around talking and like nonstop, just
Yeah.
being a
Yeah.
wild child because like I had a new sense of freedom. You know what I mean? And or well, you know what I mean, some form of freedom. And they were parenting and stuff, but you know what I mean,
Right.
like driving around, going out to places, and my first car ride, I threw up all over my mom. Like I mean, because I'd never been in a car, like I had really bad motion sickness up till like 12 or 13, just because of not being in cars a lot. So,
Yeah.
or at all, honestly.
Yeah.
Um, but like, and so while I understand what they were doing, they also ignored, you know,
Right.
like,
Right.
I mean, these are still signs of ADHD. These are still signs of something more going on.
Yeah.
And
Yeah.
you kind of still swept it under the rug. You know what I mean?
Right.
And
Right.
I mean, while I understand, yes, you're right. A lot of things can be confused. The environment, all this type of you're right.
Yeah.
And that doesn't mean that the symptoms that are there aren't correct either.
Right. No, absolutely. I think this is where therapy comes into play,
Mm-hmm.
and consistency is
Mm-hmm.
very important in
Yeah.
childhood because, you don't want to misdiagnose. You
Mm-hmm.
don't want to have a lack of diagnosis that leads
Right.
to untreated, you know,
Right.
issues. And I think I do think environment is an important factor. However, I'm a big advocate for therapy. I think we should all be in therapy, but
I think we all
all of
should be
us,
in therapy with a correct therapist.
yes,
You know
yes,
what I mean? Yeah.
yeah. But, I think there's just a really big lack of education, a
Right.
lack of
Yeah.
education and a lack of consistency, really,
Oh yeah.
because, you know, had your parents just kind of kept with that, well, these environmental factors changed,
Mm-hmm.
so this is her behavior in response to it.
Mm-hmm.
If was just always even now,
Mm-hmm.
well, as a kid, she went through blah, 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 and that's the reason for her early 20s to mid 20s for her to still be the same way. There's
Right.
a lack of consistency in that scenario.
Mm-hmm. Mm-hmm.
And, while yes, obviously everything that happened to us as children is at the core
Mm-hmm.
of our issues now, and that's undeniable. But it doesn't necessarily always have to carry into our adulthood. If
Right. Right.
consistency in childhood in
Right.
catering to these factors, then adulthood can
Right.
be much more productive and much more stable.
Right.
And
And
you know,
that's one thing like I know it's useless thinking about the what ifs, but I was like
right,
if they
right,
would have put me on an ADHD medication at a younger age,
yeah,
then I feel like a lot of things maybe wouldn't have like present within me now. You know what I mean?
yeah,
Like, and I'm not saying they're great parents. I love them. They did a lot of things correct. They did a lot, what I believe is correct. They did
yeah,
so many things, and sometimes I just want to mention that before anything, you know what I mean? Because they're great
right,
parents. They do so much. They are awesome. And the stuff that they lack in, they make it up for what they're great in. You know what I mean? Like,
right,
and that's okay. We all have things that we lack in and whatever. So I just wanted to go ahead and say that because I love them to death.
yeah,
Uh, and like I said, I felt like things could have been maybe a little bit different if
mhm,
like they did put me on medication or an ADHD medication, whether it's Adderall, whether it was a non-stimulant, whatever, if they could have. possibly done that, I would be kind of curious to see how that would have played out. Would I be this anxious? Would I be this, you know, energy person that just have so much energy that it just goes to my head and I spiral so much, you know what I mean?
Yeah.
Or listen, could I hold a conversation without having it to be 20 different topics without getting bored? Like, you know what I mean? Like if
Yeah.
it, and like it's just like so many things. I have to watch TV, play music, and just to do one thing on my computer, because if I don't, I can't focus on the one thing that I'm doing.
No, it's frustrating because it's like I just want to finish my original thought.
Yeah.
But then I have all these other little thoughts that come along, and I need to say these things, and they're just going to sit in my head. But damn, I just want to finish my original thought. But I
Yeah.
can't not say these other things too, because
Right.
then,
There's been times where I've cut somebody off because I had to say what was on my mind. Because if I didn't,
oh
I
my
would
God,
lose it.
yeah, yeah, I'm going to
It's
lose
not
that
me
when I get
being
it. Yeah,
rude. It's not me
yeah,
purposely interrupting. It's me like, oh, I just had a thought. Let me tell you what it was,
right, right.
before I
But
forget
that,
it.
but that's the impulsivity part of
Yeah.
ADHD.
Yeah.
And I think that too, like, that's another thing that a lot of us are highly undereducated about.
Hmm.
People think of ADHD, you think of kids, and you think of not just sitting down and shutting the hell up because you're
Hmm.
just always doing something. And
Hmm.
it really, even in my own experience with my youngest son, I would tell him sometimes in the mornings on the way to school, hey, sit down and be quiet today.
Hmm.
Sit down and be quiet. When you're supposed to, sit down and be quiet.
Hmm.
Because that is, as most kids with ADHD, that is the biggest issue. There
Right.
are is so much going on around them in school, and they
Hmm.
like want to get it out, but there's
Right.
other people who want to get it out. Sometimes sit down and shut the hell
Hmm.
up. And
I get that. I mean, I had a 504 plan. Like, what the fuck? Like, I mean, because like you said,
yeah,
testing was my biggest like problem in school,
yeah,
like it's like I know this shit. I know it. It's actually common sense in my opinion. And you put a test in front of me. You give me a psychology test right here, right now, and say you have 30 minutes, you're gonna think I know nothing about psychology, even though you obviously know. One of the questions could be, what is the term for P or what is the words in the PTSD, post-traumatic stress disorder? And if you put ones that says post-traumatic stupid disorder, I might pick that one because I'm like, I don't know right now. Like I'm panicking. Like I mean,
yeah,
like
yeah. I was studying real estate, and I took this course. This was not that long ago. I took the course, and I mean, I'm taking notes, and
right.
that's the way I retain information. If I don't write things down, and
Yeah.
that's one thing that I'm intensely teaching my fourth grader right now is
Hmm.
how to properly take notes.
Hmm.
Because if we read it and we move on and it goes away, but if we read it and we take notes, and I'm trying to teach them the difference between writing everything word for word and writing the main points, right?
Right. I had that problem
Right,
growing
the
up.
sentence word for
Yeah.
word. And I'm like, yeah, but you're still, it's just too much at a time.
Right.
So I'm teaching him how to take notes. So, I mean, real estate, I made flashcards. I took notes. I did all the things. And I go to take the test and I got a fucking 70. No, I needed a 70. I got a
Hmm.
30, like 30 something. I was like, what? I know this.
Yeah. Uh, I sometimes wish that they did verbal tests. I would do so much better
But
in that
that's
shit.
the thing, like, it's no notes.
Right.
Everybody I've ever talked to said the real estate exam is so hard. I
Right.
mean, people will take this exam 3, 4, 5, 10 times
Yeah.
before they get it. And I'm like, I have a proctor. So I
Hmm.
have someone who's sitting matching your watch. And quite honestly, I don't think they were even watching me because they didn't even realize I was done with the test. Which means I could have snuck notes this whole time and you wouldn't even known. You could have given me a heads up. hey, I'm here watching you.
I don't give a fuck what you do. Hey, if you have your
Make sure
phone on you, it's fine.
right? Make sure you don't pull out your phone. Like, give me something here. I
Tell
could
me that you
have
don't
done
give a
this
shit,
with my
please.
notes. Like,
Like, yeah, give me an indication you don't give a fuck about this. Like, come on, like.
for real. Like, I had to tell them. They didn't even know that I was finished taking it. And the phone is pointed at the computer. So you can see what I'm doing. You couldn't have been paying attention. Like, there's no way.
Well, I mean, that reminds me. There was I was talking to a friend of mine, and he was talking about something. He was talking about how with me that I am hot or cold, or I go from one extreme to the other. And oh yeah. No, it's not that type of friend either. No, 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 no. Anyhow. And he was saying that like you go from one extreme to the other. You go from like you're hot and cold depending on the day, what's going on, everything. And I'm like, and he has the same disorder as me. It's almost like I have a disorder that makes me go from hot to cold where I hate you or I love you. Like, I have a disorder that I cannot control, and there's no medication out there for.
Right,
Like, I mean, I
right.
can I can control what I say, I can control what I do, and I do, and it's gonna slip out. It's gonna show in some form or another because everything needs to come out at some point.
Yeah,
And it's not
yeah,
like toxic. I'm not rude or anything like that. But
yeah,
there's times where I have zero patience in a conversation with him, or there's
yeah.
times when I have all the patience in a conversation with him, and he notices that, and I'm like, it's almost like I have a disorder that affects how I am and
Yeah.
it affects my personality. It's almost like I have that.
Right.
That's not
Yeah.
me excusing it. That's me explaining that, hey, there's aspects of myself I cannot control. Now, I can control
Right.
how I
Right.
talk. I can control how I treat somebody or how I manage it or
Yeah.
how I let it come out. Like, of course, like I said, I don't do it in a disrespectful and a toxic way, but he notices it because I am hot or cold. It's my tone, it's how I
Right.
talk. And
Right. Yeah.
that's one thing that I don't think people realize is, one thing, I know we went to BPD, but like that's one thing about BPT. It's like I believe that you can control how it presents. In a sense of like if you're angry at somebody, I believe that even though that anger feels like 100, believe me, I felt that anger of 100. And you can be like, hey, I need a moment. Whatever. You can
Yeah.
even if you say, I need a moment, and that person's not giving you a moment, in my opinion, that person kind of just laugh. Just let it all out because right now you're telling them you need a moment. If they're not respecting that moment, that's on them. Like
Right.
you
Right.
you
Yeah.
try to communicate, hey, as best as you can in that moment, because usually when you're in a fury of anger and you say you need a moment, and somebody presses you and be like, no, I don't want to leave you right now. I want us to talk about this, but you're like, I can't control what I'm going through right now. And I'm
Yeah.
about to fucking lash out at you. And that's even more than what most people get from a BPD person.
Right.
Like
Right.
you push
Yeah. I
past
mean,
the
you're
first.
very self-aware. You're very self-aware.
Yeah, I am. And so that's why I have that more of like, if they press past the I need a space and they
Right.
push past it, I'd be like, I am at my 100 right now. You keep pressing me, you're just gonna turn into way worse of a situation than you want and I want. So I
Yeah.
have that self-awareness. I have that moment to say that. Now, if they push me further than that, oh. Then I'm gonna be like, you have no right to say I didn't warn you. I mean,
Yeah.
at the end of the argument, I'm like, you have no right to say
Yeah.
I didn't warn you. You know how I am when I'm angry, and I will say things I don't mean. You can't get offended with what I say because I already told you I will say things out of anger that I don't mean, and I don't mean it. And I think that's one thing people don't realize. It's like if you say things out of heated anger, you mean it. No, you don't. No, you don't. And that's the most bullshit thing I've heard because I have said time again before in a heat of anger or whatever, because part of how I work is I can think of how can I make this person leave me if I get too scared? How can I destroy this relationship or sabotage this relationship if I get scared or
Yeah.
whatever? Doesn't mean I want to. It's just I take mental notes like that, or
Yeah.
if they betray me, what can I remember? Whatever. You know what I mean? It's not me being toxic or well, it might be toxic. I mean, honestly, I don't know.
Yeah,
But
but not intentionally. Not
ex
like,
exactly. I just get scared in relationships if I feel any form of trapness, whatever. But
hmm
the thing about it is, in the heat of anger, I'm just going to go into that repertoire that's there, even though I don't 100% mean it. But since I've thought about it before, it's like when someone asks you, do you have thoughts about hurting yourself or others? And you say no, whatever. Do you have any plans on how you're going to kill yourself or whatever? I'm like, no, but I've had plans since I was young. So, I mean, technically, can't really ask me that question because
right, right.
I've had plans all my life. What do you mean? Like, I mean, are you talking about whether I have intent or not? Now, that's the question you need to ask, not whether I have a plan or not, because everybody most likely has a plan in some way. So that makes no sense. What you're really asking is, do you have intent to go on this plan, basically?
Yeah.
And so that's just what I'm saying. It's just like, I think people even though he has the same disorder or whatever, what I told him was I think and he didn't say he disliked it, but I could tell he doesn't really like it. You know what I mean?
Yeah.
But like what you don't like within me is what you avoid in yourself. And so maybe, and he's like, I hate it when you hold a mirror up to me. And I'm like, what do you want me to do? And so, but I think at the end of the day, people have these thoughts about how each disorder works, and it's marginalized so much by society and by media and all this type of thing. Because
Yeah.
I tell one person I'm BPD, sometimes they have a scared look on their face, and I'm like,
Right, right,
you just met me. How
right.
the fuck can you say I'm already toxic?
Well, I think because a lot of people think borderline personality is split personality. And split personality is in, oh, this is what I've seen in the movies. This person goes from good to evil in a split second. I think that that is commonly what people think when they hear borderline personality disorder.
Mhm.
Oh, they can laugh and curse you out in the same sentence because they're just crazy. Like, you know,
I mean, but that's not exactly totally wrong either. You know what I mean? Like it's not as evilized as it is.
right,
They get it right to an extent, but they don't because they how they represent BPD is 100. Like
right,
you're going to the worst of the
right.
worst of the worst.
Yeah,
And I'm like, how is this fair? You know what
right.
I mean? Like, you're showing the worst of it instead
Yeah,
of showing that most people have BPD and they're not a person who's going to kill everybody around them.
right,
They have the
right.
thoughts. I mean, I certainly do. I mean, I think that pairs with my harm OCD, but you know what I mean? Like, I mean, I think it's a little bit of everything, honestly. But like, like I think, like I said, and that's one thing that they do in movies too. They get ADHD wrong in movies, but you don't see ADHD people being evilized. You just see them being misunderstood or quirky or this or
Right,
that.
right. Quirky. Yeah.
Yeah, like
Oh, I forgot where I put something. Oh, I can't sit still. Yeah,
exactly, like, and OCD is presented in a way of like quirky too, and all this type of stuff.
yeah.
And I mean, so why is all these other disorders getting a good light on them, whereas the ones over here are getting a bad light on them?
Well,
Like,
I
even
think
bipolar has a better view on it than BPD does, and they're almost exactly the same thing.
yes, yes. I think it's because people associate BPD and bipolar more with physical aggression and violence than they do ADHD. When you think ADHD generally, if you're uneducated,
Mhm.
or have a lack of education. When you think of ADHD, you think for
Mhm.
forgetfulness and hyperness.
Mhm.
My mind's always going and I forget everything. That's what you think when you think of ADHD if
Mhm.
you're undereducated.
Right.
When you think of BPD and bipolar, you naturally think, oh, crazy violence, aggression.
Mhm.
It seems to be the case for people.
Yeah. I guess my question would be, but why is bipolar still less scary than BPD? That's
Yeah,
what I don't understand. Like,
I think it's the word personality. I think the word personality really gets people and they think, oh, so you have different personalities in the sense of, or even relate to schizophrenia. Oh,
mhm.
you have different personalities. You have different people living in your head that
Mhm.
have different personalities. Just from my observation of other people, I think that's what it's the personality disorder part that people jump to a conclusion of, oh, you've got different people in there, you've got different personalities in there.
Well, I
So
mean,
I think that's the difference.
I mean, and I mean, see, I never even thought of it that way, ever. I mean, I know I've been in the therapy world for a long time, but when I first heard about it or whatever, I never even thought about it being multiple personalities or something. Because when I think of a personality, I think of the way you talk, the way you act, the way you think, the way
Right.
you are. Like people growing up to me says, "You have such a good personality because I'm funny, I'm charming, I'm all this type of things." So
Yeah.
when I think of personality, I just think of how you talk, how you act, whatever. But
Right.
borderline personality is basically being I even remember if anybody wants to know a great book to read, is Buddha and the Borderline. Fantastic book. It will explain BPD. It will explain also DBT, which is actually one of the best known one of the best known ways to help people with BPD. It's one of the DBT has helped me a lot too, actually. And that's a really good book to check into. But also, I also watched Girl Interrupted, and the main girl has BPD. And there's also a book called Girl Interrupted. They're both good, in my opinion. It is trigger warning on Girl Interrupted and a trigger warning on Buddha and the Borderline. It's not as bad in Buddha and Borderline, but definitely there is trigger warning in Girl Interrupted because a girl does kill herself. So I will say there's that trigger warning I will put on there. But
Got
but basically but Buddha and the Borderline is the more like calmer thing in my opinion of like the book. It's really good. I enjoyed it. I read it all in like 2 days. It was
Oh
really good.
wow.
Yeah. It would have taken me less time if I didn't actually have shit to do in real life, um, so it was but the way they explain it and even how marginalized, how bad that it was back then of that time being of how borderline was such like when she went into groups, her therapist at that time didn't want to even give her that diagnosis. No psychiatrist wanted to like it talks about back then how bad BPD was even bad to even talk about or say about it. When she told her friend was like, "You don't want to have that diagnosis." And she's like,
Yeah.
why is nobody understanding what I'm the doctor or psychiatrist that told her about it um was like, do you have this? Do you have this? Do you have this? And she did this, She's like, yes, 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 yes. And he's like, you have borderline personality disorder. She's like, she checked off everything, just like how I do. It's like you check off
Check us
everything.
out on YouTube at Rhea Higgs, ReaHHagues. You can also keep up with us on Instagram at Just the Who Podcast.